needle pulses are +1 bilaterally. And now I'm going to listen to some of your heart sounds, okay? So I'm just going to have you, I'm just going to unbutton the top part, and we're just going to, that way we can see your chest a little bit more.
Okay.
Okay, and then you can hold it up there if you want to. Okay. Alright, so I'm going to listen to some of the heart sounds on the front real quick. Okay, I'm going to listen down here real quick. Okay, heart sounds are normal. They are +2 strength. There's no abnormal sounds or deformities or noises, heard extra sounds, none of that. So now I'm going to look at your neck. So I want you to kind of turn your head sideways a little bit right here. Okay, and then I'll have you turn to look at the other side. Okay, there's no JVD noted. The skin on the neck is intact. There's no lesions, wounds. The color of the upper extremity skin is normal. It's consistent with the rest of the skin tone. It's pale, inappropriate skin tone for season. Okay, so now I'm just going to listen to your carotid pulses, so up here on your neck, and then I'm also going to listen to it with my stethoscope as well, okay? Okay, carotid pulses +2 bilaterally with palpation. Carotid arteries are +2 regular with auscultation, no bruits or abnormal deformities or masses on neck noted. Respiration rate is regular, it's unlabored, effortless, and quiet. So now I'm going to inspect your chest for just a second, and then we're going to listen to some breath sounds, okay? So I'm going to come around here. Okay, so the skin on patient's back is intact. There's no deformities, lesions, wounds noted. The patient chest ratio is 1:2, and there are no visible deformities. Okay, I'm just going to have you take a deep breath in for me. Okay, and then you can let it out. The patient's breathing is effortless. Do you have any cough that I should know about?
No.
Okay. So now I'm going to take a listen to some of your breath sounds. I'm going to start here on the back, and then I'll come around to the front just a second. Okay, and every time I move the stethoscope, I want you to take a deep breath in and let it out, okay? Okay, now I'm gonna listen to some breath sounds on the front, okay? And every time I move, just take a deep breath in. Okay, breath sounds are clear. No abnormal noises heard, no rhonchi or crackles. Okay, now I'm gonna have you lay down for me. And then I'm gonna pull this blanket up underneath you, sorry.
You're fine.
So I'm just gonna ask you a couple questions. Do you remember whenever your last bowel movement was, and kind of tell me about your patterns?
Yesterday, and I probably go about like every other day.
Okay, and then what about urination? When was your last void?
This morning about 6:30.
Okay. Do you have any issues with frequency, urgency, pain, or discoloration
No.
with bowel movements or
No.
urination? Okay. So I'm just going to put this blanket over,
Oh.
and I'm going to lift up the gown real quick. That way I can take a look at your abdomen. Okay. So abdomen skin is intact. There's no abnormal wounds, lesions, pulsations, no involuntary movements. The patient's stomach is flat. Okay, so I'm just gonna take a listen to some of your bowel sounds, okay?
Okay.
Try and warm up my stethoscope. Okay, patient has normal active bowel sounds, no abnormal noises heard. Okay, so now I'm just gonna palpate around your abdomen, and I want you to tell me if you have any pain or tenderness, okay? Okay, any? Okay, no pain or tenderness reported. There's no masses felt with palpation. Okay, now I'm going to test some strength in your lower extremities. Okay, so I'm going to move this up a little bit. That way we can test it here. Sorry about that. Okay. So the first thing I'm going to do is I'm going to put my hands up here, and I want you to try and squeeze your legs together for me with resistance. So squeeze your legs together, okay? And I want you to push out against my hands. Okay, thank you. Now I'm going to have you try and lift up your leg with resistance. So I'm going to push down and you try and lift up for me.
Okay.
Thank you. And then this leg too. Okay, thank you. So the patient, we have to do it down here too. Okay, so I'm going to have you push against my hand with your foot. Okay, and then I want you to pull back as I push. So I want you to flex your foot up. Okay, good. And then down here too. So push against my hand. And then pull up. Good. So patient's lower extremity strength is +5 bilaterally. So now I'm going to test for crepitus, which is like popping and cracks whenever we move some of your joints around. So I'm going to start on this side first. Okay, so I'm just going to have you kind of relax your leg, and I'm just going to kind of feel for. Okay. I'm going to feel it in your ankle. Thank you. Then I'm going to go over to the other side. Okay, no crepitus heard in lower extremities. Now I'm going to test some of the sensory areas in your lower extremities. So you remember earlier how we did the sharp and dull test? So this is the dull, the like cotton ball Q-tip side, and then this is the sharp.
Mm-hmm.
So I'm going to put it around in your lower extremities, and then I want you to tell me if it was sharp or dull, okay?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Patient sensory is intact in lower extremities bilaterally. The skin on the lower extremities is intact. There's no lesions, wounds, masses, scars noted. Okay, now I'm going to have you stand up, and then we can finish up our assessment. Okay, so we're going to test the crepitus in your upper extremities now, listening for cracks and popping. So I'm going to start on this side. Okay. Okay, I'm going to come around to this side. Okay. Now we're going to test some range of motion exercises. So I'm going to start up here with your jaw. So I'm going to place my hands here, and then whenever I place my hands, I want you to kind of open and close about 3 times, okay? Okay, no crepitus heard in upper or lower extremities or in jaw. Range of motion is +5 in the jaw. So now we're going to test in your head. So I want you to put your chin down to your chest like this, okay, and then all the way back up. And then I want you to put your right ear to your right shoulder, left ear to your left shoulder. Okay, +5 strength in head. Okay, now I want you to bend over and touch your toes for me so I can take a look at your spine. Okay, thank you. You can stand back up. +5 range of motion in spine. Now we're going to test some hip movements. So I want you can pick a leg, whichever one you want to start with. So I want you to lift your leg up like this, okay, and then out to the side, and then back, straight forward. Okay, then I want you to do it with the other leg. So forward, out to the side, back, and straight forward. Good, hip range of motion intact, +5, or yeah. Okay, now I want you to pick a foot again, or pick a leg again. So pick a foot, and then I want you to point your toe, flex your toe, and make some circles. Okay, switch feet. Point your toe, flex your toe, make some circles. Thank you. Okay, so range of motion intact on lower extremities. We're going to test some range of motion things on your arms as well. So I want you to put your arms out straight like this. Okay, then I want you to cross your arms. Okay, now put the other arm on top. Good. Then I want you to go back out to the side. Then I want you to put them behind you, and you can cross them like this. Good. And then I want you to go all the way up, and then cross your arms back like this. Good. +5 range of motion on upper extremities. And then I want just to look at your wrist as well. So I want you to flex your hands like this, point them down, make some circles. Good. +5 range of motion on wrists as well. And now we're going to test just 2 more things. So this first thing is going to be your gait, so walking. So you're going to start against that wall, and I want you to walk normally, just how you would usually walk down that wall. Okay? Okay, now can you walk on your toes for me back this way? Good, and then on your heels. Good, and then if you could do, last one would be heel toe. Okay, thank you. Gait is well balanced, coordinated, No lag, limp noted. And it is smooth as well. The last thing we're gonna test is on your skin. Okay, so I'm just gonna take your hand, gonna lift up on some skin here. Okay. Trigger was tested and there's no tinting noted. You can go ahead and have a seat and relax. We're done with our head to toe assessment, so I'll come back in and check on you in a little bit. So thank you for your time.
Thank you.